Pinellas County, about 5% of tests that are done come back positive. That number, for the county hasn't really fluctuated much. So we've been looking pretty good. And what we're looking for is to see that trend to go down. Let's see. All right. And Mayor, that's basically all I have. I have, more numbers if you want me to share at some point, but there's no report.
Fantastic. Thank you, Amber. Does anyone of the group, anyone have any questions for Amber related to what's happening in Pinellas or St. Pete? If so, you can either raise your hand and I'll recognize you, or and if you click on participants at the bottom, you'll see the list of participants and raise hand is over there, or I can just, you can call out your name, and I see Renee Flowers. Yes, Renee.
Good morning, everybody. Amber, the breakdown that you have for St. Petersburg, and the number was 195, was that 195 persons tested or 195 positive COVID tests?
That's 195 positive COVID tests. Unfortunately, I can't break down total number tests by municipality. We only have those numbers for countywide. But yeah, 195 cases.
And of those 195 cases for St. Petersburg, is there another graph that would show where the cluster potentially of those that are positive are, and if those numbers transcend more into older age or minority representation?
We are able to break the cases down by zip code data. So that allows us to look at maybe the more vulnerable populations. We haven't delved too far into that yet. At a city level, it's really limited to the data that we have. So I can't look at age groups or age ranges within a certain zip code. It's just strict case numbers. So, these are the amount of cases in 33701 we can pull, and that's available on the DOH dashboard.
Okay, thank you.
You're welcome.
Jason.
I was wondering if this data was available anywhere on a daily basis for people to go to and just sort of keep track. I think it's reassuring for people to see when it flattens, and just to have a sense that someone's really paying very close attention to this.
Absolutely. So the Florida Department of Health updates this information twice a day, usually around 11 a.m. and about 6 p.m. And it's on if you go to floridahealth.org, floridahealth.gov, it's on their website. So I can actually, and it's broken down by state. You can go to county. That's where you're going to find your zip code data. It's all available to anyone who wants to see it. Yeah, floridahealth.gov, I'm sorry.
Great, thank you. I will check it out. Thank you.
Thank you.
Watson.
Good morning, and thank you, Mayor, and thanks for all of those involved in the committee. My issue is whether or not, and I know today we're doing testing in the African-American community, which is commendable. Do we have any data relative to the number of African-Americans who have been tested, and if they have been tested, where was the location?
Unfortunately, data doesn't get that granular for testing yet with the Florida Department of Health. So we can see a case breakdown with the African American community. We can't see how many were tested yet. And, honestly, we can't get a good idea and get a sense of, where the gaps lie until we see that testing data. I think right now we're, I want to say 13% in the African-American community make up the total cases, but until we can see the testing there. So is the reason because it's lower testing that we're not seeing higher numbers, or is that, an actual representation? So we're waiting for more data from Department of Health to be able to get that granular and see what the testing looks like and where our disparities in the testing are.
Thank you, Amber.
Chris Seinacher.
Thank you very much. So I'm excited, and it seems like everybody's asking the question about the testing. So I just want to add on to that. I mean, I'm glad we're doing some testing in Childs Park today. Mayor or anybody on the call, is there a strategy for Pinellas County about testing strategy, like what populations when, and how, like just how are we going to roll out our testing strategies per se?
Honestly, not that I know of yet. So we're on the phone with Pinellas County 3 times a week. Testing is available by all hospitals. Any provider can recommend a test for someone, and there's different drive-through locations in the county. Looking at vulnerable populations and those target testing, we're just at the beginning stages of that as testing capabilities are ramping up and become more available. So I wouldn't say we're there yet. I'm not comfortable saying that, testing's where it needs to be. I think we're slowly getting there, but we still have a ways to go before we can, I think, accurately say that, we're testing everybody that needs a test.
Deputy Mayor? I'll get you next, Dex.
Thank you, Mayor. I just wanted to quickly advise the panel that Amber will send out those reports that she shared to everybody in this advisory group daily throughout the duration of our EOC. We'll add that as a point of protocol in our practices.
Thank you.
Dex?
So just, I'm not sure if you've said it already, but just wondering what the percentage of the population has been tested in the Pinellas County area or St. Pete?
We're roughly at 1%. If you think Pinellas County wide, we have about 1 million people, give or take a little, and we're just over 10,000 tests.
And there's plans of ramping up in terms of supplies of testing kits within the area within this week, or timeline maybe?
I think every day we ramp up a little bit more. Sometimes the limiting factor isn't the number of testing kits. The limiting factor is the PPE. So sometimes we may have the kits, but we don't have, the N95 masks or maybe it's the swabs that we need to perform the test. So there's a lot that goes in with it, to include PPE, testing kits, swabs, and staffing.
Thank you.
Dr. Berman and then Dr. Mungan.
Amber, my question is for the drive-through locations like Childs Park today. Do you have any time frame on how long those tests will take to come back? Because I know they're going to the state lab versus probably a commercial lab. Any idea?
So ideally it's a couple days, but I did ask the DOH team that question on Friday. They're actually telling the patients that are coming through 7 to 14 days, because depending on what the lab backup is at the state lab, it's possible that those tests get routed through the private labs. So to be safe, we're saying 7 to 14 days, but we're hopeful that it'll be faster.
Dr. Mungan.
Yes, I suppose I'm just really reiterating and trying to get a better sense of, is there a funding issue with testing, or is this something that we see that we will be, like the governor's working on getting tests, or is this basically just on us to try to identify places where we can get more testing and more testing supplies?
I think it's a little bit of all of those things. I think it's the partnerships, and nobody can do it alone, I guess is the best way. So DOH has staff that can perform the tests. The cities and counties can push to get the testing kits. And I think Childs Park shows a success in that multiple partners and agencies came together to pull it off. The city could have done it alone, and DOH would not have been able to do a large operation alone either. So I think it's a combination. There's so many funding opportunities out there right now. I don't know that funding is an issue with the test. I think it's just everybody wants them, and we're waiting for the manufacturing to ramp up on those.
Scott, you had your hand up, and then I see Michael Vivio's hand.
Yes, and one thing, I think it is important that we look at those test results as a percentage of tests. I think that's critical because as we do more testing, we could get an increase in the aggregate number or the raw number of tests, but that may not be indicative of any surge, but only indicative of more testing. The other thing that I think is critical to remember is that percentage positive on the test is percentage positive on symptomatic patients. The percentage positive, and there's really very little need to test on asymptomatic patients because, again, as you see, we're only running a 5 to 6% positive rate on those symptomatic patients. That number gets much smaller when you start testing asymptomatic patients. And we really need to save resources for those symptomatic patients on a just-in-time basis.
And let me add that you know, as a city, we can't, or we don't determine how many tests we have, but we do continue to advocate on every level of government. And Amber is, as she indicated, she's on the phone with Pinellas and the state constantly to influence where those resources go, and so that we can get as many tests here as is possible. And what's happening in Childs Park today is really an example of that, where through our advocacy, we're able to get some of those tests into South St. Pete in particular. So, Mike Vivio.
Thank you. Mayor, taking the question in a slightly different direction, can you give us an idea of the coordination between other decisions being made in Pinellas County, hear word of beaches, them considering beaches opening tomorrow? Can you give us a sense of that kind of cross collaboration?
Yeah, and I'm on the phone with the county administrator, Barry Burton. Barry and I try and talk about issues like that. Certainly, what the county does and the positions that they take related to their order. You know, that's why the actions that we're and what we're going to be doing today, and what I'm going to kind of be charging you all with, is really important, because I want to make sure that our voice is a part of the decision-making process that the county goes through. We are certainly in a better position if we are aligned with the county in the decisions that are made. I think it works better when the county and the city are on the same page. So, yeah, we do have those conversations. I have also have conversations with Mayor Castor across the bay. I think it's important that Pinellas County and Hillsborough County, to the greatest extent possible, and St. Pete and Tampa, to the greatest extent possible, also be aligned in the decisions that we make. We may not be, you know, perfectly aligned, but certainly I think it's important that we be as closely aligned as possible. So, yeah, those conversations are ongoing. And I see, Doug, and you have your hand up. And then if there are no other questions, I'll get into some additional comments. Doug?
Sure. Just wanted to stay on the testing for just a second. Two-part question. One for our medical professionals. With the emerging antibody testing, is there, how much value do you place in that? And then to Amber also, you know, when do we see that coming online in a greater fashion in the state of Florida, if we place value on that?
You know, with the antibody testing, there's a lot of different considerations. It can't be used and replaced of a COVID test to tell you if you are sick now. It's more of a historical snapshot. And I think it's important for us as an indicator looking forward and, you know, restarting St. Pete, you know, to get an idea of what's the potential immunity do we have in the community. Widespread antibody testing, I don't think we're there yet. I think it's a conversation that, you know, will be a much bigger conversation coming up. I will say for our first responders, Pinellas County does have antibody testing coming for all first responders in the county, EMS, fire, and police. So that will allow us to get the ball rolling a little bit. And what that can do on a first responder level is, if, you know, depending on how that test come back, it can show that we have a certain level of immunity in our first responders, and then we're more strategically place them, whether it's with our COVID units or more of the frontline places. So antibody testing it's going to be a big conversation. It needs to be a big conversation. So I think every day we're getting closer to that. It is being looked at. So I don't have an answer on exactly where we're at right now and what the strategy is yet for the county, but it is a topic of conversation. And I think as those kits become more readily available and the FDA approves more, we'll be able to get those into the county.
And I see both Dr. Berman and Dr. Mongetz, I think, wanted to chime in on this.
Yeah.
Dr. Berman?
Just for everyone's education, there are two types of available tests right now. There's what's called a PCR, which is the rapid test that we use to detect the virus. And that's the test that they're doing at Child's Park, where you stick a swab way back in somebody's nose and sample the virus. That is highly sensitive and what we call specific. So it's a really good test, although there's been some articles published showing that that test can remain positive for several weeks, which we know in children, we see that a lot with the PCR test. The problem with the antibody test right now, there's many problems, and Dr. Mongetz could probably weigh in on that as well too. A lot of these tests were pushed out very quickly. They haven't been validated. You can get these tests, the type of test we're talking about, you get a lot of what we call false positive results with that type of testing. And it really needs to be studied better to determine which is the most appropriate test. The other issue we don't know about is when you do develop an antibody response, how effective is that antibody? How well does it work? Just because you have antibody doesn't mean it will necessarily protect you. And then we also don't know how long the antibody will be there to protect you. So there's a lot of questions with this. And I know everybody keeps talking about the antibody, but we have to be very careful when we're using that as a screening tool, particularly in patients that never had symptoms, and we're just going to do this antibody test to make a determination whether they can work out in the field. I think we just have to be very careful.
Dr. Mongetz?
Yeah, just to add on to what Dr. Berman said, I just really think we should temper our expectations for antibody testing. It has been touted in some countries as, an immunity passport being passed out to people, but unfortunately the testing is in such a state that I think that would be unwise to do. I know that many providers, Quest currently is offering an antibody test, and there are many physicians in this county that are ordering those tests on their patients. Just, as a FYI or as information, it is just very problematic to interpret, primarily for what Dr. Berman mentioned. But the other point also is that we don't know if we are identifying coronavirus infections from the common cold coronavirus. And so we know that most of the population has been exposed to that, and yet every year we become infected again. So not only are we really testing for this coronavirus, and also how long does that immunity last and what level of antibody confers immunity, that really makes a big difference. So we ought not to hang our hat on antibody testing as a short-term solution to try to open up the city.
Great. All right, thank you guys. Great questions. Thank you, Amber, for all that you're doing for us. So as I mentioned, aside from attending and Amber talked about the roll call meetings that we have every morning at 8:30, but I've also been meeting virtually along with hundreds of mayors from around the world, a meeting that's held every week by the Bloomberg Harvard City Leadership Initiative. During these meetings, we've heard from guest speakers who have included former Presidents Clinton, Bush, and Obama. We've heard from Bill Gates, and just this past week, Speaker Nancy Pelosi addressed us. We also receive weekly reports and updates from Dr. Joshua Sharfstein, who is the Vice Dean for Public Health Practices at Johns Hopkins, and from Dr. Tom Frieden, who is the President and CEO of Resolve to Save Lives, which is a $225 million 5-year initiative to prevent epidemics. And I attend weekly meetings held by the U.S. Conference of Mayors and the Florida Urban Partnership, which is a group of mayors representing the 7 largest cities in the state of Florida. And so what is clear to me from those meetings with these experts and the mayors from around the country and the world, for that matter, is that we're all facing the same challenges, but we're having to do so in ways which best fit our individual cities, all while trying to deal with multiple layers of government who are also making similar decisions, and dealing, of course, with human nature. everyone's desire to get back outside and to get back to normal as quick as possible. There will undoubtedly be new federal CDC guidelines at some point. Our governor will either let his emergency declaration expire and cede some of these decisions back to cities and counties, or he'll extend and amend his state of emergency and a statewide order will continue. But we're also in communication with our county partners, as I mentioned earlier, as they are making Pinellas-specific decisions that not only affect us here in St. Pete, but all 24 municipalities throughout the county. And of course, here in St. Pete, we have decisions to make, not only related to commerce and movement throughout the city, but my team has to decide when and how to reopen city facilities, such as those offering customer services, recreation centers, libraries, basketball courts. You get the idea. So based on information I've learned from my internal meetings with my team, from my Bloomberg Harvard meetings and from my U.S. Conference of Mayor meetings, I've begun to formulate my own thoughts on the data points and indicators that I believe we should be considering in making decisions on when to restart St. Pete and how that restart should occur. So as a starting point, I see 4 indicators that I believe are worth considering as our guidelines. One, I think it's important that the percentage of positive tests do not increase for 14 consecutive days. And I think, Scott, you were talking about the percentage also. I'm choosing the percentage of positive tests, not the number of positive tests, because the number of positive tests can easily increase if the number of tests performed significantly increases. So if our effort at reducing the spread are successful, the percentage number should not be impacted by the number of tests performed. Another critical indicator is hospital capacity. Now that our area hospitals are planning their own restart of elective cases and other care, their ability to treat those who are inevitably infected with coronavirus and becoming acutely ill will in many ways dictate our overall need for containment and for distancing. A third indicator, I think, would be the availability of testing, which so many of you talked about in your questions. Can we test each person who presents with symptoms, and can we obtain the results of those tests within a reasonable amount of time, ideally 24 to 48 hours? And I think the last indicator is our ability to contact trace. Can we trace those who've had direct contact with someone who tested positive? To me, these are the questions for our public health experts and our doctors. These 4 indicators represent my thoughts as I appear before you all today. But you're here today because I value your opinions. You have information and knowledge that I may not have had the benefit of hearing, and you represent points of view that may not have been presented to me. And so as such, your input will be important to me as I weigh all of the data, the opinions and recommendations that I have received, including those that I'm going to receive on Thursday from City Council, when making my decisions on when and how restarting St. Pete looks. Now, I've named each of you as an advisor to our efforts here in St. Pete, but as mayors often do, and as I always try and do, I will be encouraging folks beyond this call to provide information. I plan to hear more from our childcare providers, higher education, and our restaurant communities, just as an example. And so your job going forward will be to give me honest, candid, and frank feedback about your constituencies that you represent and or the subject matter in which our community considers you all to be an expert. I want your perspective. As an example, just to get you thinking a little bit. Many expect that it may be a year to 18 months before a treatment and a vaccine is available, and that life as we know it here in St. Pete and throughout the country will look different during that time. I believe getting back to normal will require a gradual but focused restart of our local economy and a responsible return to our previous culture and our way of life, while maintaining protocols that preserve and promote health. Some form of social distancing may be something we practice for quite a while. So 2 questions maybe that you all want to consider. Based on your expertise and experience, what are the indicators that you believe we should be looking at in deciding when it's appropriate to scale back some of the restrictions that are currently in place? And what are the considerations for continued social distancing, controlled or restricted gatherings? And should the use of face coverings be required, for example? I want to learn more about the risk to frequenting our restaurants or our retail stores, how they can best guard against the virus and protect not just their patrons, but also their employees. Restaurants and retail are the obvious ones, but I'm interested in the school calendar and our summer camps and youth programs and how those may exacerbate this virus, or how we can best provide public transportation at necessary levels and how to mitigate against the virus spreading on our buses. When can we once again welcome visitors from out of state to our hotels and our museums? There will be decisions to make related to not just people frequenting public spaces, but attending public and private gatherings, weddings, parties, funerals. All of these are considerations. And in addition to the intergovernmental coordinations that we will maintain throughout this process, we would ideally like our decision to be informed by industry and private sector expertise. And so I'm interested to know from you all, what industry associations, community groups, or other segments do you recommend that we connect with to share our thoughts and understand their thoughts? I want you to think about special considerations for our citizens that are at top of mind for you relative to restart. What are the imperative considerations for those who are notably vulnerable and without appropriate mitigations? And this may trigger a need for previously uncontemplated social services that our city will need to work together to create and provide. I also think it's important for us not only to think about the initial when, which is the initial time when it's appropriate to begin restarting our economy and our cultural quality of life, and the how associated with that initial restart, how we do it, but I think it's really important that we consider the next trigger and the trigger after that. What indicators do we need to see to trigger the next when and the how? So I don't want us just to be thinking about what's the initial trigger that lets us start reopening and how we do it, but then what comes after that and how do we continue this process? So I'll weigh all the opinions that I receive against the guidance of my city team, as well as our city council and especially our county health department. All these questions are being asked with the understanding that some of these questions may be answered for us, as I mentioned above. Quite frankly, we could get preempted by the state or the county. That's why one consideration for me is whether we can get through the next 6 months, year, or even 18 months, abiding by state and county orders, but also practicing what I'm going to call the St. Pete way. Can we replace additional city directives and orders with simply doing the right thing? Looking out for one another, helping each other understand the consequences of not doing it the right way. I think that's something for us to consider. I mean, the truth here is none of us are experts in how to reopen a city following a global pandemic. When I took my oath of office, they didn't give me a book that said, here's your pandemic guideline, this is what you're supposed to do. This is a unique and challenging time. But if anyone is up for it, it's us here in St. Pete. I've learned a lot in nearly 6.5 years. And the one thing that I've learned time and time again is that in this city, there is a spirit that is unmatched anywhere. There is magic that happens here in St. Pete. Our people are engaged, they're passionate, and they're willing to do whatever it takes to see this city succeed. So I look forward to connecting with each of you in the coming days, with having those honest, frank, candid conversations. Please don't tell me what you think I want to hear. I need to know what you really think. I need to learn from you, and that I can take that information and make the best decisions possible when the time comes. So with that, I'm going to go down the list one more time and call your name. And if you have any questions for me or for anyone else that's in the group or Amber, as it pertains to something I've said today, please let us know that. I'll ask that you hold any additional thoughts that you have related to anything I've said, unless you have a question for those one-on-ones. And so let me go down the list one last time. And again, I thank you all for being here, for caring, and I look forward to speaking with you one-on-one. Dr. Berman, anything any final questions?
No final questions.
Wonderful. Olga, any final questions?
No final questions. Thank you, Mayor.
Thank you. Amber, anything final from you?
No, sir, I'm good. Thank you.
All right. John Collins.
Thank you, Mayor, for inviting the arts and culture industry to the table, and I look forward to our conversation.
Thank you, John. Duggan.
No questions, sir. All is good and look forward to talking to you.
Thank you, sir. JP?
No questions, thank you.
Wonderful. Dexter?
All right. No question here. Thank you.
All right. Renee?
Good morning. I bet you all thought I had a question. No questions, and I look forward to our one-on-one.
Thank you, Renee. Watson?
Thank you, Mayor, for this conversation, and certainly I look forward to our conversation and hoping that we can get some better numbers or timelines out of this issue with Childs Park and what will be Bartlett Park. So you and I will have a good conversation, I think, coming up.
I look forward to that, and I think that the testing results we get from both those sites, I think will absolutely give us some additional data that we didn't have otherwise. So thank you, sir. Dr. Mungett.
Thank you for bringing together this great group. I do have one quick question, sorry for Amber. What is the contact tracing capacity of the city? Do we have ourselves as the city any contact tracers, or do we rely on the Department of Health, or where do they come from?
Right now we rely on the Department of Health and their EPI program.
And how many are there?
I'm not sure. I know that they brought in, the governor gave them some extra capacity where they brought in some additional epidemiologists from the college universities. So they do have more capacity. I'm not exactly sure what it is here locally.
All right, thank you.
You're welcome.
Jason?
Thank you, Mayor. I have a compliment and a question. I think that you and the city have done a really good job managing that. And as we've seen other political leaders around the country not managing it as well, it makes me grateful to be here in this place. My question is, do you have a list someplace of your 4 ideas or 4 principles for reopening that we can direct people to? Is that up on the city's website someplace?
No, it's not, KT. It looked like you wanted to jump in.
I just wanted to say that we'll discuss that internally and figure out the best way to make that available. And we'll share that with this advisory group.
Great. Thank you very much.
Thank you. Brad?
Thank you, Mayor. Thank you for recognizing the importance of public transit to our city, and I look forward to our conversation.
Wonderful. Thank you, sir. Scott?
Thank you, Mayor. No questions at this time.
All right. Chris?
No questions. Thank you.
Wonderful. Dr. Tomlin?
Thank you, Mayor. I just wanted to underscore a critical point you made earlier, that while this cross-section represents sectors and intersections that we know will inform many of your decisions, that this is the tip of the iceberg, and you're talking to many people across our city, opinion leaders, influencers, people who run higher education, faith leaders, restaurateurs, bar operators. And to that end, as you consider things for the mayor, please also send his way or our way those people who you think are critical for us to touch base with. We appreciate that feedback as well.
Thank you. Mike?
Thank you, Mayor. No questions.
All right. And Dr. W?
Thank you all. No questions, and I look forward to our discussions.
Wonderful. Again, thank you all so much for your commitment to the city. Thank you for taking time out of your day today, for joining me on this Zoom meeting, and I really look forward to our one-on-one conversations with each of you guys. Thank you so much again.
Thank you.
Thank you.